It is 8:32. I will call the meeting to order. This meeting is being recorded by the Valley Health Regional Collaborative, the VHRC. If any other persons present are doing the same, you must notify the chairpersons at this time. Okay. No discussion or comments will be entertained unless requested upon by the board or the chairperson or the board or committee. Okay, new business. So the nurses' activity since our last meeting, we had a vaccine clinic in Deerfield, which 52 people attended. 2 flu clinics were held in Montague with Walgreens. One was held in in Greenfield by Stop and Shop was our host agency. And then we also had one that's not on the agenda, but we did one the other day at the Sunderland not assisted living, it's elderly housing complex, Sunderland Place, I think it's called. And they had only 8, but they were happy to get anybody there because they don't get a lot of participation. More clinics are planned for October 2025 and November 2025. Sarah's been working really hard getting Stop and Shop to go to Shutesbury for a clinic. She's had tons of hiccups. Getting QR codes out and QR codes having the wrong address. It's just been a big process. So I'm hoping that they can fix this for next year. Otherwise, we may need to come up with alternative plans because we don't want people to have a bad experience registering. We want this to be easy so that they come back next year. Walgreens has been really good, except for they just canceled the clinic at the Franklin County Tech School because they didn't have enough pharmacists to give the vaccines. So it's really hard when we don't have the funds to be able to buy our own vaccines, that we're like at the mercy of everyone else, so that we can't hold the clinics exactly the way we want, with the exception of the one in Deerfield, which went really well. Everybody seemed to be happy. That's about it on that one. Myself and Anne, we did a community baby shower at the Greenfield Library. There were over 100 new and expecting mothers. It went really well. We were able to share our new mom and baby brochures. I was just looking around to see if I had one I could show you, but I don't see one in my reach. They're fantastic. We're getting out there into the community. Sarah has completed her presentation for the American Public Health Conference. She continues home and office visits, and then again, receiving lots of vaccine questions from the public about the clinic that she's holding. Sorry, that was a lot. Any questions about what I just went over? No, okay. We do have a Stop the Bleed training scheduled at Frontier. We were supposed to go yesterday, but the teacher ended up with an illness, so we are going next week. This is going to be a really amazing presentation. I think we ended up purchasing 3 arms that actually bleed. We have the tourniquets. We made little first aid kits to give out to the students because this is a CPR and first responder course that they're doing at Frontier. So I'm really excited about it. So I'll let you know how it goes next week, but I think it'll be good. We have a new inspector, Anna DeFord. She is working on her Foundations of Public Health certificate. She completed the Serve Safe Manager. She's gone out with Corey on a couple inspections. She can do food inspections at this point just because she has her Serve Safe, but before we actually let her go on her own, we'd like us, to shadow her a bit more. Any questions about Anna? Yes, Ryan.
Maybe just what's the expected timeline for her being available?
We can go out with her at any time. So if you need help at an event or something like that in Montague, we can help. But I would give it probably 2 weeks before I'd feel comfortable sending her to an establishment on her own.
Okay, no worries. I don't have anything that's pressing right now. I just wanted to be aware.
Okay.
I also wanted to know, I think you already answered this question. I just completely forgot what the answer is, but what is the status of the shared services I don't remember her position, but the administrative position that we have.
Mary?
Yeah, Mary. I know her name. I
Um,
just forgot what her job title
yeah.
is.
So, Mary is 10 hours a week. She was originally hired for 19, but because of Social Security requirements, she needed to cut down. Um, so she will be helping me with all of the reporting to the state with like the smart sheets, VHRC billing and things like that. Um, she hasn't been able to do a lot of that in the 10 hours, so I'm really looking forward to having her.
Should be able to do more now that I have somebody.
Yeah, we now have a clerk as a full-time Greenfield clerk.
part-time,
So-
so.
Oh yeah, part-time, sorry, 19
That's
hours.
different.
She's here every day, which is exciting. So Mary's kind of teaching her how to do some of those roles so that Mary can pick up more of my work. Um,
Is there a possibility that the part-time clerk in Greenfield would be interested in being partially funded by VHRC for the remainder of those 9 hours? Like the difference between,
I'm full-time.
oh,
think she is.
I don't think she can do that either because she is also on Social Security.
well, it's worth a shot.
Yes.
I think perhaps maybe we should revisit this budget item like next year, but
Oh, absolutely. Yes.
yeah, okay, cool.
Mary will be able to go back to 19 hours January 1st.
Oh, well, that's great.
Yours too.
Yeah, and she'll be only mine. So
Cool.
that will help a little bit.
Well, thank you.
Yeah, no problem. Let's see. I think I may have gotten this question answered already. Sarah has decided to drive to the American Public Health Conference instead of flying. She figured it would be cheaper that way instead of trying to rent a car and things like that. So she was hoping that Leverett and Shutesbury could use that would give her permission to use the $200 that they had originally said that she could use on the flight towards gas tolls and hotel or whatever else she wanted to put it towards the trip expenses. And I think John and Noreen both said that they're sure that it won't be a problem.
Yeah, we discussed it at the Shutesbury Board of Health meeting last night, and we're fine with that.
Great, thank you so much. Update on any open food and housing cases. I don't think we have any open right now with anybody that's present. I do have an open well permit out in Sunderland that I'm just waiting for a water sample. And I did a housing inspection out there after some neighbor complaints. But I can discuss that with Sunderland on a separate time. Okay, here's one. Reminder that all training, especially food and housing tier 1 through 3, need to be completed by all health inspectors, including town funded. The purpose of the state action for the Public Health Excellence 2.0, like the SAFE 2.0, is to get all health departments to provide the same level of service no matter the location. Leverett, this one is coming to you, I think. So we have been informed that Steve Ball has been criticizing the way that we have been doing housing inspections, especially the house that I had condemned earlier in the year. And I think the part of the issue is that he has not been to the tier 1 through 3 food and housing courses that we are all going to. And I think it's really important that we get everybody on the same page because this is why this program has started, so that we all provide the same exact services. Mike, did you want to weigh in on this one?
I'm just concerned if he's had any housing training. Because when we were up there, we did the whole thing was about the house itself and then them living in a trailer next to the house and kind of occupying both spaces, which was totally not, I mean, it's not allowed. They're not allowed to live in a trailer over 30 days. They didn't have, proper water and sewer hookups. The house itself was a mess, and they were partially living there just during the day and then occupying the camper at night.
Mike, can you come forward? It's hard to
Yep.
hear.
So yeah, so the concerns were valid. And the building inspector for the FERCog also deemed the structure unsafe as well. So I mean, the building definitely should have been condemned and the trailer should have been removed. So I'm not sure what his concerns were with that. I've been doing this for a while and everything that was up there was totally out of code. And again, these people in, you know, in the grand scheme of things were people that were pretty much just taking advantage of the landowner. You know, they weren't up there doing work like they told her they were doing. They were pretty much just squatting in the trailer in the house. They had temporary wire hookups, you know, extension cords going in and out. All that stuff would have deemed the place condemnable. So I'm not sure why he kind of pushed back on that. I'm not sure if he's just concerned that people are taking his spot or you know, because I know he was concerned about some stuff in Sunderland and he said some things down there. But again, I mean, I've never met Steve, honestly. I only am going by a third party, what I hear from other people and the people I've worked with or people I've been doing septic up there with. And I mean, he might be a great, nice guy. Just some of the things that I've seen, he wasn't fully doing the job that I think should have been done.
I mean, are you wanting a response from me to that?
You don't have to.
No, it's just, it's my opinion at this time. I'm just concerned that now he's kind of coming after you guys saying things are done wrong, but I'm just assuring you that nothing has been done wrong.
Well, I don't know if this needs to be a collaborative discussion at this point. I can get Steve involved with this conversation and he can point out his vantage point. Which I don't think Steve will have any problem with.
Yeah, that would be good because it's, you know, but I think the main point of this is that everybody needs to get the same training. That is what this grant is about. So if you have somebody that has not gone through tier 1 through 3 training, that is what SAFE 2.0 is requiring.
Okay, it's tier 1 through 3 housing
and food.
Housing and food.
Yeah.
And just to be clear, I did all of my orders to correct on this property with Bree, the training hub.
The state.
Yeah, the state inspector. So I did it exactly the way she wanted me to, according to the state guidelines. She did everything with me. She reviewed my orders to correct. She did everything with me. So I know that I did it exactly the way the state wanted it.
If I could just offer another, I don't know anything about this specific scenario, so this is just kind of a third party perspective, and not about Steve, just about the code issue. We've dealt with similar things here where, you know, there's been campers in town that have had to be condemned and essentially, you know, removed from properties. And there's also been times where the board has felt really strongly about not displacing someone for you know, kind of unusual circumstances. And what I'd say is, like, when you do get into that situation, it's not a matter of the code saying it's okay. It's a matter of needing to have hearings or other kind of mechanisms for the board to allow that if that's something they want to do. So, for example, we had one where the board made a vote, you know, all 3 members voted to essentially not continue enforcement because this gentleman, like, essentially had nowhere else to go. So if you do get into stuff like that, there are mechanisms for handling it, but it's not something where you can, you know, you're supposed to just say like, oh, there's no violation here at all.
We do that in Greenfield too. We have a few campers that
It's
you
like
know,
an
if they
equity.
have a place where they dump their sewer and things like that. We can make exceptions. You know, we definitely do that in Greenfield as well.
Yeah, I mean, you gotta have discretion. It's just kind of being on the same page on what we're looking at, because as everybody knows, codes and everything change every year almost. So it's more of just, I want to make sure we're all on the same page and we're not kind of stepping on each other saying different things, because first off, that doesn't make us look good. Because then people are gonna be like, well, this inspector from this town said that, and then this said that, and then, you know, and then it becomes a whole thing. So I just want us to be all on the same page and not kind of stepping over each other.
Totally. And that's why with the food inspections here, you know, there's been a couple restaurants that have come back to us and been like, you know, why is Corey citing this? And we've tried to really support Corey in anything that he's, you know, doing, just to make sure that we have like a unified front.
Yeah.
Yeah.
What happened in the resolution of this case you're referencing?
In our case,
No, the condemnation.
So the people left. They packed up the trailer and they ended up leaving.
Okay.
We were just bringing it up because there are now other complaints on the property that really doesn't have anything to do with our complaint, because ours is gone. It's it was,
Yep.
Yeah, I mean, housing is just, it's the hardest part, honestly, of health to do, and it's just tricky. And even in just like the year that I left Massachusetts and went to Vermont, codes changed. They added things, they took things away. So it's just trying to keep everyone up to date, because I know, especially working with some older inspectors, that they know that it was this way, but I'm like, things change, and it's just trying to keep everyone more up to date on the inspections and what we're supposed to be looking at, to the current code.
Do they have a computer-based interface that you have on an iPad when you go for an inspection and you check things off, or is it all done by handwriting? I mean,
So Relevant has a housing code, but I don't think anyone liked that. That's why you guys got rid of it. Honestly, it's easier to just go through, write down your observations, and then scan through the code and just find the sections that fit, and then just cite those. I just cite them in a formal letter with the section, and then I give my brief description of what I saw and what I believe is the solution to fixing it.
And I could say the tier trainings are really well put together. I had participated in some of the local public health institute trainings that existed, 5 years ago. And the improvements they've made from that to now, where you're working with Bree, the regional trainer, like really one-on-one to get to a place where you're uniformly applying the code, has been extremely helpful, even for, someone who's been in the field for a while.
Yeah, I mean, I took my housing training in like 2018. And, so it's what it is now compared to what it is then, even though I think they still have some of the same teachers, which is funny, but yeah, it's still vastly different.
and then the last thing I have on the list is that Corey has completed the soil evaluators class. I know that he's not technically a VHRC employee anymore, but he'll still be helping us out until the new inspectors come up.
He will actually be headed to Shutesbury with me after this.
Uh-huh.
Did you mention, I know there was somebody that you offered a job to, or we offered.
Oh, Jim,
Jim.
yes, he started after I made the agenda. Jim, are you here? And actually, no, it's not 9 o'clock yet. Jim will be coming in very shortly. He is doing his Serve Safe today. He started on foundations. He's only been here for 2 days, but he's already gone through several foundations of public health classes. Oh, there he is, Jim. He's early.
There you go, they're on.
Jim, these are all of the members of the Board of Health from the towns that you're going to be covering.
Okay, good morning, everybody.
So we have Arlene.
Jim.
Hello.
Yeah. Do you guys want to just do a quick introduction?
Sure,
Hi,
I'm
Jim.
John. Go ahead, Ryan.
Oh, sorry, John. Hi, Jim. I'm Ryan. I'm the Director of Public Health for the town of Montague.
I'm John Hillman. I'm one of the Board of Health members in Leverett.
I'm Arlene Reed, and I am on the Shutesbury Board of Health. I'm subbing today for our members who usually attend this meeting. My first time at this meeting.
And I'm Tim Hilche. I'm a select board member and Board of Health member in Deerfield.
Good morning, everybody. It's a pleasure meeting you all.
Welcome.
Thank you.
And Jim is fairly new to public health, but can you just tell them a little bit about your background?
Yes, so though I am fairly new, mostly kind of like, in the field, I have some extensive background, when it comes to academics, and along with my own personal backgrounds and the workforce in general, which stems from personal health, personal home health aid, both in a hospital setting, along with on a personal setting, so going to people's housing. I also have some extensive background along with behavioral health in general, more than a decade in that in behavioral health, and also a little bit of background itself and compliance and monitoring, along with because I also was the HCC health compliance officer for the past 3 to 4 years.
And he speaks 4 languages?
Yes, indeed.
Well, welcome aboard.
Thank you.
Any other questions or anything else we need to talk about today?
Do we need to approve minutes?
Yes, we do. John sent me some edits already. So one of them is the date at the end of the, yeah, we fixed that. We fixed that Mary Bordeaux was in attendance. We added that Sarah is having a flu clinic hosted by Stop and Shop. And there was one more edit that we made. Oh, the adjournment time. We changed it to 9:15 a.m. Anybody else have any adjustments before we vote to accept the minutes? No. Okay, does anybody want to make a motion?
Make a motion that we accept the minutes with the draft suggested by John.
Second,
Second by Tim and okay. Do we have a motion to adjourn?
No,
Yeah.
we have to vote on the minutes first.
Oh, sorry. Wait, what did we just do? Oh,
You just said
Motion
you
and
were a
second.
motion to adjourn.
I thought we just did oh, we didn't say all in favor. Got it. Okay. And are you in favor, Ryan?
Yes.
John?
Yes.
And Tim?
yes.
Arlene, I would ask you, but I
I
sorry.
understand. I don't have a vote. I understand.
Okay,
Yeah.
I'm sorry. All in favor? Okay, now do we have an emotion to adjourn?
Make a motion to adjourn. Do we want to set a next meeting or do we already do that?
We haven't already done that, but can we just do let me just make sure that the one that we normally do, the second Thursday, is okay for next month. Let's see, second Thursday. Oh, I'm glad you said that because I have tier 3 housing that day. Every Thursday looks like. And that's also MHOA conference week.
MHOA is the 6th, first Thursday.
First Thursday, okay.
Second Thursday would be the 13th.
Okay, I am in tier 3 housing on the 13th. Could we do the 12th? Is anybody free the 12th at 8:30 a.m.? It's a Wednesday, the second Wednesday. Ryan says yes.
I'm only good, but I have to get off at 9.
Okay,
I'm going to be in oral surgery, so I'm not available.
okay. Can we try the 19th? That's a Wednesday as well? Ryan's a yes?
Wednesday, I have a 9 o'clock Wednesday morning, so, but
Ditto.
it's fine. I mean, what time is it now?
About
It's
9.
8:56 now.
Yeah, so it's if there's not a lot, it's doable.
Okay.
So either one is fine with me.
Tim, are you around that morning?
I don't think I can be available.
Okay.
Are any of the Mondays good for you, Megan?
I can do Monday the 10th.
Works for Tim.
Let me just make sure on the other calendar. I have 800 calendars.
John, how's Monday the 10th for you?
That's fine.
And Tim?
Yes.
Okay, let's do it. Monday the 10th, 8:30 a.m. I'll send out the info. 10th, 8:30. Motion to adjourn?
Motion?
Second,
That was Tim that said that? The second, okay. Ryan, second, Tim. And all in favor? Tim is a
Aye.
yes, John is a yes, and Ryan is a yes. And we are going to adjourn at 8:57.
You know, you have to include your vote also.
Oh, I vote yes.
You've been forgetting.
Thank you.
that.
all right. Thanks,
All right.
everyone.
Bye-bye.
Thank you all. Bye-bye.
Bye.